Hello, I'm Dr. Sarah Williams, speaking to you from here in the UK. Today, I need to talk to you about a hidden risk to your heart that most people never consider. This isn't about poor diet, lack of exercise, or family history. It's about something many people take every single day, often without a second thought. In my clinical experience, I've seen patients whose hearts were damaged not by disease, but by treatments they were told were safe and necessary. What makes this especially concerning is that the damage often develops quietly over months or years without obvious warning signs. So if you're over 65 or caring for someone who is, this conversation could be far more important than you realise.
I'm about to share information that could genuinely protect your health. At this moment, while you're watching, there may be a pill in your medicine cabinet. A pill you likely took earlier today. A pill prescribed by your doctor, one that millions of older adults take daily, and this medication may be slowly, quietly, and permanently damaging your heart. Not irritating it, not mildly affecting it, but causing progressive harm that often goes unnoticed until a major collapse occurs. I'm Dr. Sarah Williams. After many years working with patients affected by heart disease, I've seen hearts that were irreversibly damaged by medications that were considered routine. Hearts that functioned normally before treatment began. Hearts that failed not because of lifestyle or genetics, but because of long-term exposure to specific prescriptions. What concerns me most is what patients consistently say. My doctor told me it was safe. I was told I needed it. No one warned me it could affect my heart. I won't name the medication yet, because if I do, many people will stop listening once they realize they're not taking that particular drug. That would be a mistake. There are 7 commonly prescribed medications that affect the heart in similar ways, especially in older adults. I'll explain all 7 before the end. But first, it's important to understand what this damage looks like inside the body. Let me tell you about William. William was 72, a retired postal worker, generally healthy throughout his life. He didn't smoke, rarely drank, stayed active, and maintained a healthy weight. His main issue was arthritis in his knees, which made walking painful and daily movement difficult. His doctor prescribed a common pain medication, widely advertised and used by tens of millions of people. William followed instructions exactly, taking it twice daily. It helped. His pain eased, he became more active again, and enjoyed time with his grandchildren. What William couldn't feel was what was happening internally. The medication gradually increased the workload on his heart. His blood pressure crept upward. His body retained more fluid. His heart had to pump harder with every beat. Month after month, year after year, this strain continued unnoticed. Initially, his heart compensated. The heart is remarkably adaptable, but that ability has limits. William's heart was slowly reaching its threshold without anyone realizing. The first signs were subtle: mild breathlessness, fatigue with exertion. He assumed it was aging and didn't mention it. But it wasn't normal aging. His heart function was declining. As time passed, William began waking at night short of breath. He needed extra pillows to sleep comfortably. Lying flat caused discomfort and a sensation of pressure in his chest. He assumed it might be reflux or poor sleep. What was actually happening was fluid accumulation in his lungs. His weakened heart could no longer pump blood efficiently, causing fluid to back up. Each dose of his pain medication worsened the problem by increasing fluid retention and vascular resistance. Eventually, William collapsed while working in his garage. Paramedics found low blood pressure, reduced oxygen levels, and clear signs of heart failure. Imaging confirmed severe damage. His heart was enlarged, weakened, and functioning at less than half of normal capacity. When his medication list was reviewed, the connection became clear. The arthritis drug he had taken for years carried known heart failure warnings. There were safer alternatives, but no one had reviewed the risks. William now lives with advanced heart failure. He takes multiple cardiac medications, struggles with basic activity, and has permanently lost his independence. This isn't an isolated case, and William's story highlights a critical issue: age-related heart reserve. When we're younger, the heart has extra capacity. As we age, that reserve diminishes. By the early 70s, many people are already using most of their heart's functional capacity just to meet daily demands. So when a medication increases workload by even 10 to 15%, the heart may simply not cope. That's exactly what happened to William. This same mechanism is affecting millions of older adults today. Now let me introduce Dorothy, whose experience demonstrates a different but equally serious pathway of damage. Dorothy was 68 and treated for mildly elevated blood pressure. She was prescribed a commonly used calcium channel blocker. Her readings improved and she felt reassured. What she didn't know was that this medication can weaken heart muscle contraction in certain individuals, particularly with long-term use. Over several years, Dorothy's heart muscle cells gradually lost strength. Some cells died and were replaced with scar tissue. This process caused structural changes that permanently reduced her heart's pumping ability. She felt increasingly fatigued, but attributed it to aging. Routine blood tests showed nothing abnormal. No heart imaging was done. Eventually, she collapsed while shopping. Tests revealed severe dilated cardiomyopathy. Large areas of her heart muscle were no longer functioning. When her medication history was reviewed, the connection was identified. This effect is known but uncommon, and more likely in older adults. Monitoring could have detected early damage, but it wasn't performed. Dorothy's heart function will not recover. She now lives with advanced heart failure. A medication intended to reduce mild blood pressure elevation permanently altered her quality of life. Next is James, whose story involves heart rhythm rather than heart muscle. James was 76 and treated long-term for acid reflux with a proton pump inhibitor. The medication relieved symptoms effectively, so it was continued for years. What wasn't monitored was magnesium. Long-term acid suppression reduces magnesium absorption, and magnesium is essential for stable heart rhythm. Over time, James developed atrial fibrillation. Blood tests revealed critically low magnesium levels. Even after supplementation and stopping the medication, the abnormal rhythm persisted. Once atrial fibrillation becomes established, it often remains permanent. James now requires lifelong treatment and has an increased risk of stroke. This medication was intended for short-term use. Safer long-term strategies existed but were never discussed. These three cases illustrate a wider issue. Many medications are tested primarily in middle-aged adults, then prescribed long-term to much older patients without adequate evidence or monitoring. Now, here are the 7 medications of concern. NSAIDs, ibuprofen, naproxen, diclofenac, increase blood pressure, fluid retention, and heart failure risk. Certain calcium channel blockers, verapamil, diltiazem, may weaken heart muscle over time. Proton pump inhibitors cause magnesium depletion and arrhythmias with long-term use. Thiazolidinediones for diabetes, associated with fluid retention and heart failure. Tricyclic antidepressants increase arrhythmia risk in older adults. Dronedarone can worsen heart failure despite being used for rhythm control. NSAIDs again, because their risk is frequently underestimated. All have safer alternatives in many cases. None should be stopped sudden. Lie without medical advice. Here's what you can do now. Review every medication you take. Bring a complete list to your GP or consultant. Ask specifically about heart risks, monitoring plans, and safer alternatives. If concerns are dismissed without discussion, seek a second opinion. Your heart deserves careful protection. In upcoming videos, I'll explain which blood tests and scans help detect early damage before symptoms appear. Please share this with anyone over 65 or taking multiple medications. Stay informed, ask questions, and take an active role in your care. Thank you for watching. Subscribe for the next episode, and take time today to review your medications. Your heart health depends on it.